Good morning. Thank you for being here today. I'm Sheriff Melody Maddox, and I want to introduce my command staff. To my right, I have Chief Deputy Randy Akes, Colonel Miller, who is my jail commander. We have Captain Long, our administrative commander, Captain Bell, Director Hunter, and also with our members of the medical service team is Ms. Terry Van Dorn here, Nurse Pamela Spencer, Dr. Jacobs, and Gail Harris. It's all part of the medical team. And as the head of this agency that is responsible for the operations of the jail and care of the inmates, I felt that it was important to have this discussion to update the community on the efforts of the COVID, the COVID-19, commonly referred to as the novel coronavirus. As you know, early this week, it was announced that we had 2 cases that have been identified in Georgia, right next door to us in Fulton County. And this starts a reminder of the public component of public health. It is only a matter of time before the first case in DeKalb is reported, and we recognize that the inmates are particularly vulnerable at this point. We have, on a day-to-day basis, some 35 to 40 individuals are processed into the jail but released within 24 hours. The typical stay for inmates are about 29 days, managing the day-to-day movement of inmates inside the jail and outside to the courtrooms or other facilities, possess operational challenges that are met effectively with policies and procedures that reflect an emphasis on control for the safety of the inmates, the employees, and the community. This is what I want the public to know, especially the family and friends of the inmates in the DeKalb County Jail. We are prepared and well-equipped to handle any medical crisis that may arise inside this facility, including the potential spread of the newest infectious disease, coronavirus. Medical assessment of all detainees begin at intake, where our professional staff reviews intake documents, conducts screenings, and determines the suitability of all incoming inmates to withstand incarceration, as well as their status for a specific infectious disease as determined by the medical service vendor under contract with the agency. In accordance with the community standards of care, confidentiality regarding infectious disease of inmates will be maintained within the agency's healthcare unit. Infectious disease control is nothing new to our jail operations. Routine screenings are conducted for tuberculosis, influenza, HIV, and Ebola. Additional screenings are applied as deemed prudent. The jail infirmary has 6 isolation cells, 4 for the males and 2 for females. Patients requiring higher level quarantine are transported to Grady Memorial Hospital or other designated facilities. Throughout this facility, employees, vendors, and inmates have access to sanitation services such as hand sanitizers, and posters are reminders of the importance of personal hygiene. We are reminding our employees to wash their hands frequently, not to shake hands with peers, do not touch your eyes and mouth, and make sure that you sneeze in your arm or elbow. Make no mistakes, we do not take the potential seriousness of this medical situation for granted in our day-to-day management of the human lives entrusted to our care. For those who are wondering why we are developing and announcing this plan, I remind you that there is a family community connected to every person under our care. What happens here can impact the impact of the health of the residents throughout the county, and I want the inmate families and their communities to know we are working diligently to prevent and fight the spread of this disease.